Okay, welcome everyone. How are you all today? It is another day where we are coming together to learn more to be our best selves. And today we are talking all about putting your best face forward. And so tonight I am so excited because we have Dr. Kerry-Ann Dillon, who is a medical doctor and skilled in delivering healthcare services, medical aesthetics, and medical education within the healthcare, aesthetics, and academic medicine industry. And she has done this for over 9 years. She owns an MSc in clinical dermatology with distinction, and that has come from the UK and is a specially qualified doctor in hair restoration and skin rejuvenation techniques. Dr. Dillon is also a published research author with a keen research interest in alopecia. And she is also my personal dermatologist who has gotten my skin all the way. I don't even know if you could see it on here, but she got it all the way together. I'm so excited to have her on here today talking all about putting our best face forward and would share with us some things that we can use in our lives to help us to be that better version of ourselves. And so without further ado, let me just introduce you to Dr. Dillon. Hi, how are you?
Alicia, and thank you for that introduction. I'm doing well. You seem to be doing well as well, right? So it's good to be here. So as you, Kalisha would have mentioned earlier on, I'm definitely going to be talking a bit about the skin. Um, just highlighting a few things like the importance of the skin and why it's important to make it healthy, and just a few pointers on how you can, in fact, just improve the overall healthiness of the skin and as well as improve the appearance, because I think that for most people, that's kind of what they want, right? They want their skin to look a bit better. So it's always nice to know who's in the room with me. I see everybody has their cameras off. So I'm not seeing any faces, which is kind of weird because it will seem as if I'm just speaking to myself. So I don't know if anybody has would like to put on their cameras. I mean, I'm giving you that option, right? Or if you don't feel comfortable, that's quite fine. Thank you, Ruth. All right. So I actually do have a few slides that I'm going to share with you guys, right? But before I get into it, I think, can we show hands with this thing? I think that they do have emotions on it where you can actually show hands, because I want to ask a couple questions before. Or you guys can just say yes or no, it's really up to you, or give a thumbs up or thumbs down. It's up to you, but I think that you can't do that on Zoom. So just wanted to find out from you guys if you actually think that skincare is important. So how many of you actually believe that skincare is important? All right. So yeah, so Kelisha believes yes, that it is. Okay, great. So I'm seeing some thumbs up. Yes. All right, great. How many of you actually have the time to really, focus on your skincare? I'm seeing the thumbs up disappearing. All right. Well, I mean, it's 2025, all right? So I think that this is a perfect time for persons to really focus a bit more on themselves. I think that sometimes as women, whether you're an entrepreneur, a mom, whatever it is that you're involved in, I feel like sometimes we tend to neglect ourselves while we're taking care of other people and the business, right? But I feel like this year should be the year where we really focus on ourselves and, just being our best selves overall, including, putting our best face forward, as Kalisha had mentioned previously, right? All right, so I'm just gonna go ahead and share my slides with you. Okay, good. So everyone can see this, yeah? Okay, great. Right. So basically, as I mentioned previously, we're just going to be going over a couple of things concerning skincare. So I'm going to start off with a nice introduction so that persons could actually have a better idea of what it is, right? Because there is an actual definition to skincare. Right? So skincare more or less is where we actually get involved in that practice of maintaining and improving the health as well as the overall appearance of the skin, right? And this can be done through a lot of different means. One of the very common ways to improve the appearance of the skin would be through just having a very tailored skincare routine, right? So the routine of maybe cleansing your skin, moisturizing, and just doing that every day can actually help to improve the health and appearance of the skin. Other than that, you have other methods such as doing certain in-office procedures as well, right? Is this important? Yes. So the skin actually is the largest organ in the body, right? And it does have a few functions, right? Health definitely is one of them. Because it's the largest organ in the body, it does tend to act as a barrier to keep all of the bad things out or the very negative things, such as certain bacteria that can definitely harm you, right? So it helps to prevent certain skin conditions as well as infections, right? The appearance of the skin itself, it helps you to feel more beautiful, right? Because it does tend to enhance your natural beauty and the radiance of your skin. Especially if you have really nice skin, it's like one of the first things that people will notice, right? And whenever people give you that compliment, you actually feel a lot better about yourself, yeah, which is where the confidence aspect comes in. So it does tend to give you confidence as well. So if you have nice, clear, healthy skin, your self-esteem definitely goes up. And I feel like once you have a healthy dose of self-esteem and confidence, you tend to make more bold decisions, right? Because it does influence you in that aspect. By the way, if you guys have any questions while I'm doing this, that's quite fine. You could always like raise your hand and I could always, just ask you what question it is that you'd like to ask. Right. So in order to really understand skin and the skincare, you definitely need to understand your skin type as well. Because skincare is personal. There is never going to be like a one size that fits all when it comes to skincare. So if you do have a skincare routine, then more or less it should be tailored to your skin type or your skin condition. So we do have various skin types. We do have 4 main ones. We have dry skin. We also have oily skin, combination skin, and then there's a sensitive skin type. In terms of dry skin, typically these individuals will have their skin will be prone to flakiness, or it might feel really tight. It might even feel irritated at times, but it in general, it does tend to lack a lot of moisture or hydration, right? Then there's the oily skin type, which always tends to produce a lot of excessive oils throughout the day. The entire face might have a sheen, right? Especially coming down to the end of the day. So it does tend to feel very, very shiny. Then there's combination skin where you have the mixture of the oily, and in some areas of the skin, it tends to feel either normal or it does tend to feel a bit dry, right? And then you have the sensitive skin type. Typically with sensitive skin, this is skin that you're kind of born with, all right? So even though there's skin that could become sensitized, but when we talk about sensitive skin itself, it kind of is genetically predetermined, right? And this type of skin does tend to be a bit more easily irritated. It does tend to be more prone to redness and certain reactions, especially from using certain products on the skin. Right, so these are the 4 main types, and then some of you might know of normal skin type as well. So when you have normal skin, more or less you have like a really nice balance with the oils on the skin. So it never really looks very oily. It's never really dry. It always just has that really nice balance. And typically persons who do have normal skin, they don't really have like a lot of issues in their skin. They never really suffer with acne or anything like that. Right. So again, going back to understanding your skin type, once we can know once we understand what skin type you have, this is where we can actually create a routine to really fit your skin type. So for example, if you do have more of the dry skin, definitely we would recommend more of hydrating creams as well as lotions, products that tend to have like very high levels of water content to really help to hydrate the skin really nicely. I think with any type of skin type, you definitely want to avoid harsh cleansers, but typically because dry skin is more at that risk for really becoming irritated, we tend to definitely want to encourage clients to avoid harsh cleansers with this skin type, right? Then with the oily skin type, definitely you want to avoid very oily products. So the oil-free products is what you'll be looking for. Also the non-comedogenic products or the products that would not clog your pores would be products that you want to look for as well. Seeing that oily skin type is already prone for clogging, is prone for acne, then you definitely want to opt for oil-free products that are non-comedogenic, right? Exfoliation does tend to help oily skin types really well. Again, going back to the fact that we're just more prone for, and I say we're because I do have the oily skin type, we're just more prone for clogging of the pores. You definitely want to be able to exfoliate your skin at least twice weekly. Right, then there's a combination skin. So again, with this type of skin, you do have more areas of the face that might become more oily than others. So for example, the T-zone area, which would include like the forehead, the nose, even the chin area, right? The combination skin, the balance is what you tend to look for, right? But because combination skin is a form of oily skin type, you do tend to want to avoid very oily skincare products as well. You want to use lightweight products like lotions on the face, right? Rather than creams, which might be a bit thicker or maybe a bit oilier, right? Just to get that nice balance in the skin. But combination skin is a skin type that can become very acne prone as well because it does tend to have a bit more oils in certain areas of the face, yeah? And then you have the sensitive skin type. Because it's more sensitive, you definitely want to be able to use products that are very gentle. We typically tend to recommend clients to not use products that have fragrance in it because fragrance products can in fact trigger some type of reaction in the skin for some individuals that have sensitive skin types. And of course, these individuals, because their skin is sensitive, they need to be careful with the types of products that they put on their skin. So then we always tend to recommend, at least patch testing the new products before they use it in full. Right. So when it comes to skincare and skincare routines, there really is like a basic skincare routine. So typically the basic products would be like to have a cleanser, to have a moisturizer and sunscreen, but more and more we tend to be just adding exfoliation into that as well, because exfoliation definitely is a big part of the skincare routine, especially for persons that have more oily or acne prone skin, right? So definitely with the cleansing, the importance is that we want to remove just that excess layer of oils in the skin. You want to remove the dirt and the impurities. We don't want to strip the skin, right? Because having that layer of oils in the skin does help to build a very nice, healthy skin barrier. So we don't want to strip the skin of the natural oils, but we do want to remove what's excessive, yeah? So that we have different types of cleansers. We have the gel cleansers, we have cream, we have foam-based cleansers. Gel cleansers tend to work really nicely for persons who have oily skin types or combination skin because it will remove the excess oils without stripping the skin of the natural oils. Foam cleansers tend to be really nice for persons who do have dry skin or dehydrated skin, right? Because that tends to add a bit more hydration into their skin. Yeah. So typically when it comes to cleansers, we want to choose something that's based on your skin type, or you can choose a cleanser based on your skin condition. So for example, if that person has acne prone skin or they have acne at that point in time, then they want to use a cleanser that would reduce the bacterial content in the skin. So for example, the cleanser might have something like benzoyl peroxide or even salicylic acid, right? So we can choose cleansers based on our skin type as well as the skin condition. Right, when it comes to exfoliation, now the skin naturally does this. but sometimes we need a little bit of help as well, right? Because we do have different layers of the skin. The uppermost layer, which is called the stratum corneum, is that dead skin cell layer, where you might have just layers and layers and layers of dead skin cells. And typically when you exfoliate, especially if you're using some type of chemical exfoliant, something that has, let's say, an alpha hydroxy acid like glycolic acid, you want to use it at least twice weekly to really sort of buff the skin and remove that layer of dead skin cells that's there, right? When you do that, you'll notice that you actually have brighter skin. Your complexion might look a bit more radiant. Your skin might actually look a bit smoother, right? So it does help to just remove that excess layer of dead skin cell and brighten not just the complexion, but improve the texture overall. I always tend to not recommend over exfoliating. So then if you exfoliate twice a week, that's fine. If you want to increase it to 3 times a week, that's fine as well. But if you're doing something like that every day, then you do run the risk of actually damaging your skin barrier. And when you damage your skin barrier, then it becomes very unhealthy, becomes porous, meaning that you can actually have more of what we call transepidermal water loss. You can also get to the point where you have the bad bacteria getting into the skin, which can lead to infections. It can lead to more acne in the skin, right? So you never really want to over exfoliate. But if you're exfoliating twice or 3 times weekly, that does help to improve the overall health and appearance of the skin. Right. So another part of the basic skincare routine would be to moisturize. Now, I know there are a few myths surrounding moisturizing, especially when it comes to persons that have very oily skin, acne-prone skin, or just combination skin. I think with this type of skin type, some people tend to think, oh, my skin is oily, so I don't need to moisturize, right? But that's actually a myth. Every skin type needs to moisturize, whether you're normal, dry, oily. Moisturizing is very important because it does help to hydrate the skin. And when you have the hydrated skin, your skin actually functions better. It exfoliates a lot better because in order for your skin to exfoliate, meaning the function where your skin cells is sort of turn over and you get rid of the dead layer of skin. In order for that to happen, you actually need hydration. You need the water content to sort of separate those dead skin cells so that they can flake off of the skin, right? So the hydration is important to lock in that moisture. For oily skin, gels do tend to work really nicely because they have a high water content and of course less oils, all right? But oily skin types could definitely use lotions as well, creams as well, depending on the type of ingredients that's within the cream, right? For more of the drier skin types, you tend to look more for creams, lotions, because they tend to have a lot of hydration and could really lock in that hydration a lot more into the skin. Yeah. And of course, sun protection. So I always tell my clients that no skincare routine is complete without a sunscreen. Again, I know that there are some myths surrounding sunscreens, especially within the Black communities, because we think that, okay, we're Black, we don't need sunscreen. We can go out in the sun because we have that natural protection. To some extent, yes, we do, but the protection that we may have in our skin is just not enough to really prevent the UV damage that you can get from a lot of sun exposure, right? So you definitely want to protect your skin from sun damage, from any type of premature aging. If you do have like acne or hyperpigmentation in the skin, it becomes super important that you want to use your sunscreen every day because you want to sun protect as much as possible, because the UV rays can actually worsen acne, it can worsen hyperpigmentation in the skin, it can worsen acne scars, it can deplete collagen in the skin, which means that it can actually make you look older than you really are, right? So it can lead to that aging in the skin. So you definitely want to have that sun protection. And typically we tend to recommend sunscreens that are broad spectrum, meaning that they target both UVA and UVB. And they have to be at least SPF 30 and above, right? So that would provide really good protection for you. And in order for you to really get the benefit of a sunscreen, you have to use it every day. So I know there are some persons, they may be using a sunscreen, but they only use it whenever they're going to the beach or whenever they're going outside. Right? That wouldn't really, give you the benefit that you want from a sunscreen. So you have to be using it every day, even though you're indoors. I usually tell my clients, if you're going to be spending most of your time indoors, then one application a day is fine. However, if you're going to be spending more time outdoors, then you definitely want to apply your sunscreen, but reapply it every 2 hours, right? So yeah, it gives you a lot of benefit if you diligently use your sunscreen in that way. Right, so those are the basics when it comes to skincare routine. Just having a cleanser, a chemical exfoliant, a moisturizer, as well as a sunscreen. Now, there are some additional skincare steps, sorry, that some persons might want to have in their routine, and that's quite fine. So, for example, adding certain serums and toners, masks, eye creams, things like that. Persons can definitely add these to their routine, depending on what it is that you're trying to achieve. So, for example, and I mean, I tend to do this a lot for my clients as well. I do tend to add a lot of serums to the routine, especially to the morning routine. So things like vitamin C. Vitamin C, as you know, is an antioxidant. So it does help to prevent that damage that you can get from exposure to the UV rays, because it acts as an antioxidant to really scavenge the free radicals that you can get from UV exposure. Right. So I do tend to add vitamin C serums and other antioxidants to the morning routine, because I do believe that your morning routine should be one to protect you from the external factors that you're facing throughout the day, such as the UV rays, right? Vitamin C is also very good for brightening. So if that's one of your goals, that you want to brighten your complexion, you want to tone it up, also, if you have hyperpigmentation, vitamin C can help to address hyperpigmentation as well. So yeah, it all depends on, targeting your specific concern. So different things might be added to the routine just to help that person get to their goals. Toners, I always get this question asked a lot, if toners are necessary. Again, no. So this is like an additional skincare step. But some people do like toners. Toners can, in fact, prepare your skin for other skincare products. And then there are toners that tend to really hydrate the skin and add nutrients to it, as well as balance your pH, right? So if you like toners and you want to add this as an added step, that's quite fine as well. I tend to go more for exfoliating toners. So toners that would have alpha hydroxy acids like glycolic acid, lactic acid, mandelic acid, right? Because it tends to add a bit more benefit than just adding a plain old toner to your routine, right? And then they're like masks. So some people like detoxifying or soothing masks. Sure, you can use these. Is it going to provide much benefit? It depends on how frequently you use it. All right. So like hydrating mask, if you really want to get benefit from that, you probably have to use it like at least 3 or 4 times a week, right? And then they're like the eye creams. Eye creams definitely can be beneficial if that individual has dark under eye circles, right? And let's say they have the dark under eye circles because you have lack of sleep, or maybe even genetics, because sometimes when you use the under eye creams, depending on the active ingredient in it, it can actually improve the area, right? So like under eye creams that might have certain things like retinol in it do tend to improve that darkness that that individual might have underneath the eyes. Also with the puffiness, right? There are eye creams that would have certain ingredients like caffeine that could help with the puffy under eyes, right? But these are just additional steps when it comes to skincare. The point is when it comes to your skincare, it does need to be more suited to that individual. So it needs to be tailored to that individual, their skin type, as well as their skin condition, as well as the goals that you might have for yourself, right? So for example, if you have a lot of acne, and your goal is to reduce the acne, then you need to have a skincare routine that is going to help you get to that goal, right? Right. So just to give you a bit of an idea of what ingredients you can look for in when you're choosing your skincare products, as well as ingredients that you might want to avoid. I tend to love hyaluronic acid. So this does tend to be very beneficial for the skin because hyaluronic acid is what we call a humectant. So it tends to draw a lot of water into your skin and a lot of water. So it attracts that moisture into the skin and hydrates it really nicely. So whether you have oily skin type or more the drier skin type or normal skin type, it's actually an ingredient that any skin type could use, right? Then we have the vitamin C. So we were speaking about this earlier on. So the vitamin C can help to brighten your skin, it could reduce hyperpigmentation. It can help to build collagen in the skin as well. So reversing signs of aging is also something that vitamin C does, right? So I love those two ingredients, hyaluronic acid, vitamin C, and then the popular retinoids, all right? So retinoids have become very popular for the past few years, I believe, right? So younger persons can use retinoids, older individuals can use retinoids, but retinoids are kind of like the go-to ingredient whenever we're trying to treat things like acne, hyperpigmentation, reversing signs of aging in the skin. Because of the fact that they promote cellular turnover, they can help to reduce the acne in the skin. They can help to improve the fine lines and wrinkles because they help to build collagen and elastin in the skin as well, which are very healthy building blocks that, you know, everyone needs in their skin to have just a healthy skin barrier, all right? Then there's niacinamide, which is also like another antioxidant. This is actually a vitamin as well, vitamin B3. It's very anti-inflammatory and it does a really good job at controlling excess oils in the skin. And it does brighten the complexion as well. So this is another nice ingredient that you can always have in your skincare routine. And then there's azelaic acid. I tend to reserve this one a bit more for my clients who do have more acne or acne-prone skin. It does tend to brighten the complexion, but it also helps to reduce the acne-causing bacteria in the skin, right? So all of these ingredients here, I mean, the list is not exhausting, but this is what I tend to use a lot in my practice when it comes to, you know, treating clients and getting them to their goals, right? And then there are certain ingredients that you need to be a bit cautious of. I mean, the list here is kind of short, right? But these are the ones I tend to focus on a bit more. If my client has more of the sensitive skin type, I definitely want them to avoid fragrances in their routine. And alcohols, I do tend to recommend to clients to just stay away from the products that have a lot of alcohols in it because they do tend to be very, very drying. And once your skin gets that dry, it can become very, very irritated, it can become inflamed, it can disrupt your skin barrier. And once we have disruption in your skin barrier, persons can actually start experiencing like more acne in the skin. I hope I haven't lost anybody yet. Very good. Right. So I would have mentioned this previously, how your skincare routine should definitely be tailored to whatever your specific concern or just tailored to the goals that you have, right? So for example, aging skin, you want to incorporate certain ingredients like retinoids or even peptides. Peptides is one of my favorites as well. They do help to build collagen and elastin in the skin. So they tend to address certain things like fine lines and wrinkles. So typically for retinoids and peptides, these are ingredients we tend to incorporate more into your nighttime routine. Why? Because your nighttime routine is one where the skin is in repair mode. So these ingredients tend to work a bit better when you use them at night, right? And then of course, any antioxidant rich products as well, because there are some vitamin C products that you can use at night as well. Can be used for aging skin. So you want to reverse signs of aging. So those are the types of products or ingredients you want to look for. With the acne-prone skin, I would have mentioned this earlier on, using the products or ingredients that have like salicylic acid, benzoyl peroxide, they tend to control the acne bacteria as well as the excess oils that you have on the skin. So this will be very beneficial for those individuals. Right. Hyperpigmentation, which does tend to be one of the major issues that my clients might, want to book an appointment with me for. Even though they might have acne, they tend to be a bit more focused on the hyperpigmentation because nobody really likes to see the spots on the skin, right? But with the hyperpigmentation, yeah, we definitely want to use brightening agents. So those agents could be things like vitamin C, could be niacinamide, azelaic acid, alpha hydroxy acids like the glycolic acid, lactic acid, mandelic acid. Those tend to really address hyperpigmentation really well. And this is all topical skincare we're talking about, right? And then there's the hydroquinone, which is one of the best ingredients that you can use to address hyperpigmentation. However, if you're going to be on hydroquinone, especially if it's going to be a prescription strength one, like 4% and up, then you definitely need to be under the supervision of a doctor. Yeah. And of course, you want to be consistently sun protecting. If you do have hyperpigmentation and you are trying to address this, you definitely need to be avoiding excessive sun exposure as much as possible, as well as just being diligent with your sunscreen, because you can have a routine that has all of the lovely ingredients to address your hyperpigmentation. But then once you are not protecting the skin from the UV exposure, which could actually worsen your hyperpigmentation, then it's like your routine makes no sense, right? So sun protection would always be super, super important if you have like a pigmentary disorder in the skin. For sensitive or sensitized skin, definitely you want to avoid any harsh exfoliants. You want to avoid over exfoliating. You want to just stick to very non-irritating formulations as well as hypoallergenic products, right? And I mentioned sensitive or sensitized skin because a lot of times persons might say they have sensitive skin, but they actually don't. They have sensitized skin. And I want to ask this question because I don't know if anybody knows the difference between the two. Do you guys know the difference between sensitive versus sensitized skin? Anybody? No? All right. So when it comes to sensitive skin, I would have alluded to this in the beginning by mentioning that it's something that you're, that is genetically predetermined, right? So you're literally predisposed to this type of irritation or redness in the skin. So like you're born with it. So for example, somebody who has eczema or psoriasis, right? Or even rosacea. So these individuals, they're genetically predisposed to that sensitivity in the skin, and it's not something that can really be reversed. Yeah. When it comes to sensitized skin, it's just a temporary condition where the skin just becomes increasingly sensitive. And usually this is because of certain factors. So for example, that person might have been using a very, very harsh product or scrub. And I'm just going to use this as an example, like the apricot scrub. Let's say they were using that scrub for a long period of time, and it just made their skin very, very red and irritated. So that person's skin would have been sensitized, right? But it's just a temporary form of sensitivity in the skin. So it is something that can be reversed. So for example, if they stop using the apricot scrub and start using more healing products in the skin, more soothing products in the skin, then that sensitivity could go away, right? So one is permanent and one is temporary. Right. So now let's talk about the lifestyle factors that could affect your skin, because there are some, habits that can really make or break your skincare routine. Yeah. So diet and hydration, definitely, if you really want to have really nice, rich skin, I think that your diet is important. So if you consume like a lot of sugary foods, maybe even a lot of very oily foods or foods that have very high amounts of dairy, then it is possible that your skin could respond in a negative way. All right. So having a nice balanced diet, rich in your vitamins, your minerals, antioxidants do tend to support healthy skin, right? And support a healthy skin barrier. Drinking water, of course, drinking water does help to support healthy skin, but not in the way that some people believe. So some people believe that when you drink a lot of water, then that helps to hydrate your skin. The reality is hydrating the skin is actually better when you apply topical products to it. So for example, you apply hyaluronic acid directly to the skin, it would hydrate your skin better than drinking water. Your skin is actually the last organ where water, like internal water, would get to, right? But when you drink enough water, of course, we're talking about keeping your system nice and flush from toxins. So then your body in general does tend to work better. But does it actually really, really hydrate the skin? Not so much, right? Then there's, of course, stress management. Now, there are some individuals who might respond negatively to stress. So whenever they're stressed out, they might get a lot of breakouts in the skin because of that fluctuation in the hormones. So managing your stress can actually be beneficial for your skin. And you can do that through, incorporating like relaxation techniques. Yeah. Or just doing something fun that makes your stress levels go down. Right, sleep. So this is actually another big thing when it comes to having healthy skin. So it's actually really crucial for your skin to go into its repair mode and be able to do so effectively, right? Because once your skin is in repair mode, then your skin cells get regenerated well, right? So I know for most of us who are business women, right, it might be a bit difficult getting that amount of sleep, but I always try to get at least 7 hours in per night, right? So that way, the skin is healthy, gets to repair the way that it should. Right. So let's talk a bit about the bad skincare habits, right? Because it makes no sense talking about a routine to improve the quality of your skin, but yet you have some bad skincare habits that can actually damage your skin. So the first one definitely is sleeping in makeup, or not thoroughly removing the makeup before bed. So if you do have this type of habit, then it's very easy for your skin to get very clogged, right? So makeup can clog your pores if you're sleeping with it overnight, right? Especially if it's very thick, heavy makeup, right? Or if you're just not thoroughly removing your makeup properly before you go to bed, right? So there are certain ingredients that do tend to remove makeup very well. I tend to love cleansing oils. They emulsify really well and they wash off clean without leaving any type of oiliness on the skin. But you can also use things like cleansing balms. I don't really like makeup wipes because they don't really do a good job of thoroughly removing your makeup, but anything from cleansing oils, balms, those do tend to work pretty well. Then there's a skin picking, right? So I always tell my clients, especially those who have acne or acne prone skin, that picking acne actually makes acne worse, right? And the reason why that happens is because you're just encouraging more inflammation, more bacteria into the area that you're picking at. And most times persons don't get out what they're trying to pick out, right? So it just overall damages the skin and it can lead to a lot of trauma. So these individuals do tend to have a lot of scarring in the skin if they have that habit of skin picking. So you always want to avoid doing something like that. If you have blackheads, whiteheads in the skin, then just get a professional extraction done from your skincare professional. Skipping sunscreen, right? I mean, we would have already spoken a lot about sunscreen before, but definitely you don't want to skip your sunscreen, especially if you are treating things like hyperpigmentation in the skin, especially if you want to get all of the good benefits that you want to get from a sunscreen. You want to keep using your sunscreen diligently so that your skin could be very healthy and resilient. Smoking. So if you do have that habit of smoking, smoking is something that is very inflammatory. It can lead to a lot of negative changes in the skin, dryness, patchiness of the skin, increased breakouts. So you definitely want to kick that habit if that's something that you do, right? Using dirty makeup brushes, right? Sometimes I know we might get busy and then we just forget to wash your makeup brushes, but it's very important that you keep whatever it is that you put in on your face, it's important that you keep it clean. So if you like makeup, like me, right? Then washing your makeup brushes does become very important to keep your skin nice and healthy, because once it gets very, very oily, remember there's oils on the makeup brushes that would attract dirt, that would attract bacteria. And every time you put that on your face, then you're actually just transferring that onto your face. And it can lead to breakouts, especially if you have acne-prone skin. So you can definitely wash your makeup brushes at least once a week, once every 2 weeks, depending on how frequently you use it, yeah? Not washing pillowcases or your linens regularly. Definitely, this is one for individuals that have very acne-prone or oily skin types. Again, if you're sleeping on dirty pillowcases, then whatever is on the pillowcase transfers on your face, right? And then you might find that one side of your face is always breaking out, and it's because of that contact that the face or the skin is getting with the dirty pillowcases regularly. So washing it regularly is actually something that can actually help to reduce breakouts in the skin. All right, not cleaning your cell phone screen. A lot of people don't recognize that our cell phone screens do tend to be dirty, right? We're always on our phones. The oils on your skin is getting on the phone itself. The makeup on your face is getting on the screen of the phone, and you're not cleaning it, right? And every time you talk on the phone, you're touching your face with it, right? So cleaning your cell phone screen can actually be beneficial, again, especially if you do have oily acne-prone skin. So just using like isopropyl alcohol, which has like 70% of alcohol, or methylated spirit, anything like that, to clean your cell phone screen can actually be beneficial for the skin. And the last one, and this list again is not exhaustive, right? There are other bad skincare habits, but these are the ones I chose to focus on. Constantly touching your face, right? So I feel like we're in a culture where most people are always like this, always want to be touching their faces, right? If you're touching your face, make sure that you know your hands are clean. A lot of the times they're not, right? So if you're touching your face with dirty hands, then again, you're transferring whatever bacteria your hands will picking up, and you're just putting that on your face, which could lead to breakouts or other issues in the skin later on. Right. So now that we spoke about the bad skincare habits, we can talk about the good skincare habits. But basically, the good skincare habits would be just the opposite of the bad skincare habits, right? So double cleansing, which is one of the things that I always tend to encourage my clients to do, especially if they have acne, if they have acne-prone skin, or if they have very, very oily skin. Persons who have drier skin types may not need to double cleanse, or persons who have normal skin types may not need to double cleanse, but definitely double cleansing does become very important for persons who are trying to really reduce the acne in their skin, or just reduce their breakouts, right? And by double cleansing, I mean using your cleanser twice on your face when you're cleansing, right? Or you can use the same cleanser to do that, or you can use different cleansers. So for example, if I have, I'm going back to acne again because it's just a really good example. If I have a client that has acne, I might suggest to them to double cleanse, but I might suggest that they use 2 different cleansers. So for example, they might use a cleanser that has salicylic acid, and they might use a cleanser that has benzoyl peroxide. The 2 of them in combination tend to work really well to just calm the breakouts in the skin, right? Of course, removing your makeup before bed, right? So this is self-explanatory. Applying your sunscreen every day, and of course, reapplying it if you're going to be outdoors for more than 2 hours. Having a balanced diet and exercise, reducing your sugar intake. All right. So what's the connection between sugar and breakouts in the skin? Right. So when it comes to sugar intake, now when you take in a lot of sugar, your body responds to that by producing insulin, right? When insulin is produced, it does tend to trigger an androgen hormone called testosterone. So then you have a spike in testosterone, which can actually act on your oil glands. So the testosterone itself can actually cause your oil glands to produce excessive oil, so then your skins get a bit more oily. When your skin gets a bit more oily, it does tend to attract a bit more of the dead skin cells, right? So when the dead skin cells get trapped within the pore, then you have things like dirt and debris getting in there, plus it attracts bacteria. And so that is just like a risk factor for acne formation in the skin. So for some individuals, especially if they're more acne prone or they have very active acne, reducing sugar intake actually does help a lot in terms of calming the breakouts or controlling the breakouts. And this one's my personal favorite, getting regular facials. A lot of times persons tend to believe that topical skincare routine and facials, they're kind of separate, but they actually go hand in hand, because the regular facials will really help with maintenance of the skin. So there's only so much that a topical routine can do. But if you have certain goals like really, reversing signs of aging in the skin, yeah, the topical routine might be fine with that. But the in-office procedures do tend to be a bit better because we have certain things that can target your issue that can really improve the outcome, right? And then, of course, reducing stress. You reduce stress, then you reduce the hormonal imbalance that you have in the body, right? And so that can help to calm your any breakouts that you might have in the skin as well. And of course, getting enough sleep. And we would have spoken previously as to why that is important. Oh, and that's everything that I have for you guys. So if you guys have questions or anything that you wanted to raise on any of the slides that I had spoken about previously, now's your time to do so.
Yeah, so we had Ruth that has a question.
Yes. So, well, I've never really had acne prone skin, and I think that's hereditary because my mom nor my sisters have ever really had like any type of acne prone skin. However, one of the things that I noticed when I guess when I turned 45, I believe, is that there was this area of my skin that really became sensitive. And it was more like the lower area around my mouth and stuff like that. So it became so bad that even when I applied any type of makeup, hypoallergenic makeup, anything on my skin, and it stayed on there for a little while, and I got into the sun, I would have a reaction, meaning that I would actually have blisters, like small, fine heats around my skin. And I didn't understand what that was. I consulted with a dermatologist. They eventually gave me some products to help clear up the skin, scent-free products. But we also realized that even the sunscreen, because the thought was that if I got a sunscreen, it would help. And the sunscreen caused the same type of breakout. We tried all different types of sunscreen in terms of reducing the I remember the product level, the SPF level, so that we can see how sensitive the skin is. And now I don't even use anything in terms of sunscreen, which I know is bad. But it's like I'm afraid to try or test products now because of the fact that I get this very specific area that has this dry skin issue. And I noticed my mom who is in her 70s now, she developed that type of area, issue around her mouth as well. So I'm wondering if it's something hereditary that we really had not tapped into or identified previously.
Okay, so, so it's kind of hard for me to tell, right? Because I don't have you as a client, so I don't know anything about your medical history, right? But there are persons that can have that type of reaction around the mouth. Sometimes they have it around the nose and even around the eyes, right? So we call it periorificial dermatitis, and it could be due to a few things. For some persons, it's just overuse of topical steroids on the face. For some individuals, it has a lot to do with their toothpaste, using fluoride toothpaste, but I can't exactly tell you what could have been causing that for you. So yeah, it is a type of condition that can happen around the mouth. That does tend to be a bit frustrating. The rash kind of looks like acne, but it's not acne, and sometimes it can be itchy as well. So I don't know if that's that you were experiencing. But yeah, typically with regards to treating it, we do tend to like dial back on the skincare routine, keep it as simple and gentle as possible. So just like a gentle cleanser, a moisturizer, definitely a sunscreen is important. But if you had like a reaction to this sunscreen, it could have been the type of sunscreen that you were using, because some individuals do tend to respond negatively to chemical sunscreens rather than a mineral sunscreen, right? Because we have different types of sunscreens, or maybe it was some type of preservative that that particular sunscreen had that made you just respond negatively to it. What I always say to persons who have more of the sensitive skin type and who would like to try new products, just patch test it, right? So you take a little bit of the product, you might want to put it a little bit on your jawline area and just leave it there for a few hours and see if your skin responds negatively to it. If it does, then obviously you shouldn't be using it. If it doesn't, then you should feel free to try it on your entire face. Yeah.
All right. How do you feel about, I know we talked about exfoliation and stuff, the microderm abrasion method. Is that something that you would recommend for a certain skin type only, or is that something that should be incorporated into any type of skincare?
Right. So when it comes to, because it's an in-office treatment, yeah? When it comes to in-office treatment, and microdermabrasion is one of the treatments that I do here in office, it really does depend on, yes, your skin type, your sensitivity to it, as well as the goals that you're trying to achieve, right? So it's a very good method to manually exfoliate the skin. Persons who do have a lot of acne in the skin will not be very good candidates for it, because it does tend to be a bit abrasive in that aspect. And the abrasiveness with the full face of acne could actually worsen the acne. So it depends on the individual, right? If you have very sensitive skin, we have really good machines now that can be used on sensitive skin, because we do tend to control the intensity of the treatment itself. So it is a good treatment to incorporate into your skincare. If you want to get that done like once every 6 weeks, once every 8 weeks, depending on your skin and its sensitivity, then that's quite fine. But the manual exfoliation is good as well.
Okay. And my last question, I know, so since I have not been able to find, because I even tried sunscreen for babies when my daughter was born, and even that did not help. Um, I I know I need to use some type of vitamin C or retinol. Um, I am very concerned about using either vitamin C or retinol without a sunscreen. So I mean, is it that I can use one of those without sunscreen, or is it that I have to use, or I should use a retinol or vitamin C if I decide that with sunscreen?
It's recommended that you use a sunscreen in your daytime routine, right? As I mentioned previously, no routine, no skincare routine is complete without a sunscreen. You can use all the expensive, wonderful ingredients on your skin to get results, but once you're not protecting the skin, it's like you're wasting your money, right? So again, for you, I think it will be like a trial and error. Try using a mineral sunscreen, maybe a mineral tinted sunscreen, and see how that works in your skin. So that less persons tend to have a negative reaction to mineral sunscreens as opposed to a chemical one, right? And by mineral sunscreens, I'm talking about the sunscreens that have things like zinc, titanium dioxide, or iron oxides in it, right? So you should try that one, see how your skin responds to it. But yeah, it would be like a trial and error for you. So I can't exactly say, oh, try this sunscreen and nothing would happen. You have to, you know, test it out to see how it would work for your skin. Yeah, but if you're going to
Okay.
use ingredients like retinoids in the skin, especially in your nighttime routine, you want to use a sunscreen because sometimes retinoids can just make your skin a little bit more photosensitive, meaning a bit more sensitive to the daylight, to the sun exposure, right? So yeah,
Okay.
you want to have a sunscreen in your routine.
Okay. So if I make an appointment to pay you a visit, I'm bringing a list of the sunscreens I've already tested. And maybe we can go through and see, okay, so you haven't tested this one, and you will recommend something for me to test then, because
Okay.
when I tell you, I have a list of sunscreen that I have actually tested, recommended by other dermatologists, and it really has not worked, unfortunately. Even my esthetician recommended, and I wasn't
Mhm.
able to continue using it.
Okay,
So
that's not a problem.
yeah, okay. See you
Okay.
soon.
Okay, no problem. All right. Anyone had any other questions?
Yes, we had a question in the chat from Ria. She is asking about reapplying sunscreen. Most times she's already wearing makeup. Is there a facial sunscreen product that can be used on top of makeup?
Yeah, so we do have different forms of sunscreen. So there is one that is kind of like a powder that you can use on top of your makeup. That's quite fine. Then there's one like this stick, the sunscreen stick. Some people can use that up on top of their makeup as well. The sprays are a bit more technical in that when you do use a sunscreen spray, you actually need to rub it into the skin. So that one might not be the best thing if you're wearing makeup at the time, but definitely we do have the ones that you can brush on onto the skin, or you can use the sunscreen stick as well.
Sorry, I have one that you could brush on, so I will drop it off for her and she will test it out and see if she likes it.
Okay, that's great.
That's good. That's great. Okay, so do skin tools like rollers and jade stones and these things that I see people using on their face, do those really work?
That's a difficult question to answer because for some individuals, it actually does improve their skin. I think the whole mechanics behind jade rollers and those stones is that they help to improve circulation and lymphatic drainage, right? So for example, somebody who has, let's say they have puffy skin every time they wake up in the morning, that can actually be beneficial for them, right? Because it does help to move all of that excess fluid around. But is it something that you have to have in your skincare routine? No. If you do like using certain beauty tools, because I do have, you know, my own jade rollers and whatnot, then you can definitely consider using that in your routine if you find that it is something that works for you. Also for persons who might have very sensitive skin, like let's say somebody who has rosacea, where one of the major triggers is just exposure to heat and sunlight. To just calm that inflammation in the skin, using a jade roller might actually be very beneficial. You pop it in the fridge for a few minutes and then you roll it onto the face, so that cooling effect can actually help. So again, it really does depend on the individual, depend on what it is that they're trying to treat as well.
Okay, awesome. Okay. What are your recommendations for vitiligo? Is that vitiligo? Yes.
No, I understand what you're saying. It's just that I didn't expect this question. I can't really make recommendations for vitiligo, right? So vitiligo is one of those autoimmune disorders that can happen in the skin. So if you do have something like that, or somebody in your family member is suffering from vitiligo, then you need to definitely see your derm, right? So it's not like just putting on a topical skincare routine and then it helps. No, it doesn't work that way. They literally need medical care when it comes to vitiligo. Yeah.
Okay, can vitamin C serum be used at night or do you only use it during the day?
Right, so I think I would have mentioned this earlier on that there are some formulations of vitamin C that can actually be used at night. So it depends on the brand that you're using, and they also give instructions on how, they would like their vitamin C product to be used. But for most of the vitamin C products, you will find that they're telling you to use it in the morning routine, and that's because it provides that antioxidant type of effect to prevent damage to the skin from the UV exposure.
Okay, and I'm not sure, let me see, I'm not sure, I think you would have covered that. What would you consider a harsh cleanser?
What would I consider as a harsh cleanser? It's difficult to say. Again, going back to the sensitivity of that person's skin, that might actually be something that's personal, right? So for example, let's use a benzoyl peroxide cleanser as an example. You have different percentages or different strengths, right? You might find a 4% benzoyl peroxide cleanser, you might find a 10% benzoyl peroxide cleanser. So there are some individuals that they wouldn't have any type of issues at all with the 10% cleanser, but then you might have that one individual, when they use the 10% cleanser, it's a bit too harsh for their skin. So it really does go back to, how sensitized this individual skin is or whether they have sensitive skin or not. But yeah, it's a personal thing when it comes to that.
Okay, no problem. Do we have anyone else with something they would like to ask? Yeah, just on 1 hour. Time goes so fast. Well, I know that consistency would always be key. Anything that any routine, consistency is key. So how long do you think that we need to be consistently doing the same thing before we say, okay, this is not working?
Right. So especially if you're using like a new skincare routine with new products in it, you definitely want to give those products some time to work. So typically I would say to my clients that when you're using a new skincare routine, give it at least 1 to 3 skincare cycles, which is equivalent to about 18 weeks, all right? Because it depends on the ingredients that you're using as well. If you're using a topical retinoid, retinoids usually take a long time to work, roughly about 12 weeks for you to start to see like the maximal results in the skin. So it depends on that, and it depends on the other products that you're using in the routine, right? So you can give the routine a few weeks. Like I said, at least 18 weeks or at least 3 skincare cycles. If you find after, let's say, 8 weeks time, there's nothing that the routine is actually doing for you, because at that time you should start to see a little something happening in the skin, right? If you're not seeing any type of improvement at all, then this is where you might actually want to get professional help so that these individuals can help you create a routine that might actually be better for your skin. Yeah, but typically you do tend to want to give any new routine some time to work in the skin before you just call it quits.
Okay, great. All right, if we don't have any more questions, Dr. Dillon, tell us how we can make an appointment with you to get all of our questions and individual routines down back. So how could we get in contact with you?
All right, great. So yeah, so I'm not sure you guys still seeing the slide or I'm still sharing. Okay, great. Right, so you can see all my information here. So my practice is located at the TLH Plaza, which is in Milford Road, Scarborough, right? So you have my contact number here to book an appointment, because it is by appointment, 716-3979. But you can also reach out to me via email, carrieann.dillon@gmail.com. If you want to call, that's fine, but you can also send a WhatsApp message to me.
Okay, and for those of us who are in Trinidad, you do virtual consultations still?
Yes, so I still do virtual consultations, especially if it's a skin concern. If you have more of a hair concern, it's always better to come in office so that I can thoroughly evaluate the hair and scalp, because I use other tools to really get a microscopic view on the scalp. But for skin concerns, it's fine to do a virtual consultation.
Okay, awesome. Well, Dr. Dillon, thank you so much for all of the information that you have imparted on us this afternoon. We are very grateful for it. So ladies, if you need to get that consultation, you could always reach out to Dr. Dillon. I will be sure to send her information to you guys as well. And do you have any parting words for us?
Well, thank you for inviting me, Kalisha. It was a pleasure being able to, educate you guys a bit more about skincare. So I would say, if you do start a new skincare routine, just be patient with it and try as much as possible to be consistent. Also don't neglect your skin, right? It is, like I said, the largest organ in the body. It's the first thing that people tend to notice about us. And we only get one body once, right? So you definitely want to take care of it as much as possible, right? So yeah, it was a pleasure being able to share the information with you guys. So I hope you guys would have learned a few things. And you guys are actually a bit more interested in skincare now than you were previously.
Yes, definitely, definitely. Thank you so much. Okay, ladies, so thank you all for your time, for staying on and for being with us. Thank you, Dr. Dillon, and we shall meet again very soon. So have a great evening, everyone, and I'll talk to you guys soon. Bye.